My name is Martin Gaynor. I'm chair of the governing board of the Healthcare Cost Institute, and I'm the E.J. Barone Professor of Economics and Health Policy at the Heinz College at Carnegie Mellon University. This report is unique because it really is the first time we get an in-depth, comprehensive look at folks in the United States with private health insurance. This is unprecedented for insurers to come forward and voluntarily contribute data collectively for an effort like this. And I think that insurers are going to find out all kinds of interesting things that they wouldn't have otherwise known. The data tell us a number of key things. First, in the aggregate, what we're seeing is a slowing in the growth of health spending. Per capita health spending for this group grew about 3.3% from 2009 to 2010. That's about twice the rate of inflation over that period. So that's real growth. On the other hand, that's substantially slower. The past couple years, spending for this group grew about 6%. So why do we see this slowing the growth? One, fewer people have health insurance. That's likely due to the recession. We don't know that for sure, but most likely. The other interesting thing that we uncovered with these data is for those folks who retain insurance, their utilization has fallen from 2009 to 2010. Now that's very important because it provides concrete evidence on what many people have been speculating is behind the observed slowdown in health expenditure. Well, the data are going to be used in a couple different ways. One thing is that the Healthcare Cost Institute itself will undertake some analyses. In addition, HCCI will make the data available to external researchers for non-commercial scientific research. There are a few projects that are just getting underway of that nature, and independent researchers will be looking at the data on all kinds of topics. And I think the examination of the data by independent researchers will turn up all kinds of interesting and important facts that we wouldn't have otherwise known. One thing we'll be doing is we'll very shortly be getting data for 2011. The current report goes through 2010. So we're going to be having data from 2007 through 2011. We'll put out a report which has these 5-year trend numbers. That we get data very quickly. After the close of a year, it's a few months before we have the data, and then another couple months before we get a report out. And it's hard to make good policy decisions if you have data that aren't current and up to date. In addition, that we'll be looking at a few other things. We'll be focusing on some specific conditions. We turned up these interesting patterns for the 18 and under population. That's something we're surely going to investigate. Some external researchers are going to be undertaking projects looking at the impact of aging in this population on healthcare utilization and costs, the effects of the business cycle, particularly the effects of the recession, and another study that's going to look at hospital pricing, how much variation is there geographically over time, and what are the true underlying determinants and causes of hospital prices and hospital price trends. Obviously, individual insurers can look at their own data, but they haven't had the ability to get answers from data assembled like this. In addition, of course, when the data are made available to outside researchers, the best and the brightest minds in this country are going to be looking at this treasure trove of data, and I have no doubt they'll turn up very interesting and important facts from these data that will benefit all of us, insurers, but the population of the United States as a whole.